standing between the lunch and yourselves. I'm sorry about that. I will not take more than 5 minutes. Sorry, I'm standing between the lunch and yourselves. I'm going to take no more than 5 minutes. What we thought is why we thought we would launch the tele-diabetes in this session here. I wanted to know why it is really important. The reason behind it is because many people who are very young are diagnosed with diabetes nowadays, who are doing like IITs and who are doing major businesses. They're pretty young and getting diagnosed with diabetes, and they're taken off and they're just going into depression. Some of them, like 30% of them, are getting into depression illnesses, and they're not doing their regular course of their work. So for that reason, and also because we as a busy practitioners might not be able to give full time to their concerns and all their doubts. So that's we thought what we will do is let them call us, and then we can talk about whatever doubts they are having, and then we can call upon their doubts and clear it up. What they do is they call us on this number, and the patient, if there is any emergency, will be taken over by the doctor straight away. Otherwise, their details will be taken over, and the doctor will be calling them at a later time, providing that if the time is convenient to the patient. And after that, if there is some patients might be calling us for the blood tests or physiotherapies or some medications that can be delivered upon their request. And what they need is, why we need, most of the times is the doubt clarifications, dietary advice, traveling advices like insulins, and some people might even need carry the insulin syringes along with them, because if their luggage is lost or something, then they need to take it along with them. And they also need the letters from the doctors to carry over the insulins and those things. And the emergencies like too much low sugars. If they are having low sugars, less than say 60, 70, we recommend them straight away to going to the nearest casualty. And being a busy practice, like in UK, 15% of the whole emergency work is carried over in the hypoglycemias. Whereas in India, we don't see that much in here. So, but we still don't know how many of them are undiagnosed, because we still hear a lot of patients getting passed away post surgeries because of the hypoglycemias with the insulin levels. If they're able to access and if they're able to do the blood sugar testing, some of them might be able to be saved. So that is the reason, at least if they can check it and give us a call, straight away we can be able to help them. And sometimes like minor illnesses and sick day rules we can say to them, and sometimes they can also be used for insulin titrations, like especially if they are pregnant women, they can be used. And technology is all over evolving, and many people who are also working in the software industries, they are having busy lives as well. They can use the technology as well, because their sugars also can be checked over, and directly that readings come to us. And depending on those blood sugar readings, we can able to call the patients and tell them what to do accordingly, how to titrate or anything like that. And most often who will benefit from this service is the elderly patients. The patients, suppose we see patients from Calcutta and rural areas, long distance, and GDM patients, and also for the titration of insulin. And sometimes if there is a mild hypoglycemia, we can be able to manage them on the telephone itself if we have seen the patient before. And most importantly, we ask them to decrease the insulin straight away dosage, and then we can follow them, because slightly higher sugars may be not that harmful rather than the hypos. And these are the types which we commonly see. So suppose patient calls up, and if we have seen them, we can be able to pull up their records, and they can book the slot, and depending on them, we can use our system to call them upon straight away. And some of the patients might be calling up for some dietary advice, some may be calling for the insulin requirements, and some may be calling for the whether they can eat the sugar and honey or not, instead of jaggery and honey instead of the sugar, because some diabetics can be of having some similar doubts. And how we work is we can go through them, and once we have reviewed them, this screen will tell us whether we have dealt them apart from all their illnesses and all their doubts or not. And what we basically do is we clear their minds, and they can focus on their work, and we can be able to give them more opportunity for them in their growing of their lifestyle and carrying on their normal lives. And this is how the call center people will be using. And once they get the records, they can be able to take all the details and then pass it on to the doctor, whoever is on call, or if it is a non-urgent one, can be dealt with a later time. And the most commonly asked questions are diet, medications during Ramadan, and whether they are fasting. Suppose some people may be fasting on Saturdays, whether to take what medications and what not to take. And some medications with diabetes in the pregnancy, especially regarding the insulin adjustments, or whether there is a dietary adjustment needs to be done. And tips like when they are doing the pilgrimage to Hajj or even to the temples, where in North India most people will go into the temples with the shoes, whereas in South India all of our people take the shoes off. We can tell them that they can use the white socks, which are new ones they can wear. Otherwise, if they're neuropathy, then they can burn the shoes there. And also we can use the insulin injection sites, especially during the pregnancy, whether they can use it around the tummy or not as well. And alcohols, because sometimes alcohol, most often it causes the hypoglycemia rather than the hyperglycemia. So we can tell them maybe if needed to avoid, if they have the previous hypos, to avoid the tablets. Not that we encourage the alcohol, but there's still people who can drink who do drink the alcohol. And non-vegetarian consumptions, whether they can take it during the diabetes or not. And the most often we are getting nowadays is the keto diet questions from Veeramachane. We are facing a lot of questions on that one. And I'll invite Professor Sarang sir to kindly inaugurate.
I request Sarang to switch on the
we have Professor Sarang, sir, a couple of words about health economics, and we don't see what you do